Step-by-step sermons for everyday life?
Why would he read this?
Why would he hide it?
What a hypocrite. How can we use this in a cruel yet funny way?
Are you gonna be here when I wake up? It hurts.
Your appendix burst.
It was full of abnormal cells, consistent with lymphoma.
I have cancer?
Oh, I know drama makes for good content, but this is one of those rare situations for which boring is best. Very excited to be reacting to House MD Season 6, Episode 15, Private Lives. On this channel, we are reacting to all 177 House episodes, and this will be episode 126. Let's see if I can get the diagnosis before House does as a doctor working in London.
You ever come into bed?
I still say I'm a vegetarian.
A salmon is not a vegetable, Frankie.
Well, apparently 8 out of 10 commenters agree with you.
You blogged our argument. Take it down, erase it, delete it, make it go away.
And it's 2 in the morning. These walls are made of tissue paper.
Sorry.
We need a police car at 152 Haverhill.
Oh my God. I think it's coming from my gums.
Who rents porn anymore? Can't you get this stuff on the internet? Come out with me tonight. I'm going speed dating.
You're dating on meth? Count me in.
28-year-old female, sudden unexplained coagulopathy.
What does she blog? Politics, dominatrix, cooking?
It's a personal journal.
Her photos may be digital. Doesn't mean she couldn't have been exposed to some other toxin. We should search the apartment.
I can hear you in there. Open the door or I'm calling the cops.
She eats salmon and thinks she's a vegetarian. Who are the 2 out of 10 people who agree with her? If salmon is a vegetable, then chicken is a turnip and turkey is a type of mushroom. Besides our patient probably being on mushrooms with her fishy perspectives, what else could this be? Well, the patient and her partner were clearly surprised by this, meaning that it probably hasn't happened before, so it's likely an acquired disorder rather than something from birth. Acquired disorders include DIC, but patients are usually too unwell with that to bug their argument. Liver disease, also too unwell, but we know House hasn't shown liver disease accurately pretty much ever, so that's more likely. It could also be a problem with platelets that are like the glue that plug off any blood vessel micro tears that we get, but they said her platelets were normal. None of that seems to clearly fit at the moment though. We also know that she was eating salmon as they were going to a chef experimenting on a half price day. Maybe the chef experimented a bit too much and landed some toxins in her meal. Other people from the restaurant could have gotten sick around then too. E. coli 0157 could have caused something called hemolytic uremic syndrome and would fit this history pretty well. Even though food poisoning is quite common, HUS is rare, so it could tick that box. Alright, I'm gonna go with hemolytic uremic syndrome as my first diagnostic guess. Definitely would want to trace this back to the restaurant though and check for toxins rather than the house. Seems like the team's decision to check there is already backfiring for 13 and Tau, so let's find out more.
We're doctors. We aren't stealing anything. We are collecting samples.
Frankie's got some strong opinions. Wants to recycle every molecule of trash, attracting every rat in the neighborhood.
Is there any chance Frankie touched the rat poison?
Every time I put the stuff down, she picks it back up.
You need to dive back into the pool.
He has to swim in hours. Go to a bar. You bring your ugly friends. You're not that good looking.
You kind of are.
Women aren't as distracted by appearances as we are.
You want to bet? You can't tell anyone you're a doctor. We're unemployed. You still walk out of here with a dozen names. I find out what's wrong with people and I fix it.
Don't all doctors do that?
I play video games.
Oh, professionally?
I wish, bro.
I'm a chocolatier.
I could tell by your hips.
So I could afford to lose a few pounds.
You like puzzles.
I hope my job would let me play with puzzles all day long. Police detective. Turns out criminals are idiots.
Swaffed. It's one of your crossword answers. I believe it means lying manipulator. Tells men anything they want to hear. You have some natural talent as a liar. Not enough brains to see it through.
My. I've been thinking about what you said, and I'm sure I washed my hands after I threw out the rat poison.
You must be Dr. Foreman.
She reads my blog.
Personally, I don't think you're condescending at all.
If you don't want people to think you're condescending, maybe you shouldn't say condescending things. You know, I think people behave badly because there are no records of what we say or do. I don't think my pee is supposed to be mud-colored.
She may have brown urine, but she thinks she's the white knight of record keeping. Definitely not the type of person you'd want to sue you. Thankfully, Foreman has done nothing lawsuit worthy so far this episode, but knowing House's team, that may be subject to change. Either way, brown urine could mean that this is actually because of liver disease. That's because the liver removes something called bilirubin from the blood, and when it's damaged, then it could build up and stain the urine brown. It could also be a few other things like rhabdomyolysis, where their muscles break down, or just eating too many fava beans. Yes, I know that isn't the first brown you think of with those. Liver disease is the only thing from that list that would cause the bleeding as well though, so why would a healthy 27-year-old get that? Well, she could have an autoimmune disease that's targeting her liver, like primary biliary cirrhosis or autoimmune hepatitis. Maybe she got distressed after her argument and took a paracetamol overdose. Maybe she's an alcoholic. Could it be that her blog is a way of getting her attention because she's deeply unhappy otherwise? As a person who's quite literally making a YouTube video as we speak, I hope that last one isn't it. Also, there is no way Chase would have gotten all of those numbers in real life with those lines. The research actually does back what he says. Female psychology is less focused on looks than male psychology. That's because for them, mating is a higher consequence activity, since the effort of reproduction for a male can take 30 seconds, but for a female, it can be more than 9 months. That's why females are historically more selective with partners than males are. So I don't believe Chase's situation for a second, even though it makes for incredible television. Either way, let's see if I'm right about the liver.
Coagulopathy plus kidney equals what? Hoff disease fits the timing best. Start around saline and mannitol.
Oh, God! Okay, first, that's not me. My roommate was minoring in film.
The forest nymphs have taught me how to please a woman.
You can see it's not me. No one can know about this.
There's nothing she doesn't share. Angry sex is overrated. How can he expect me to be aroused when I'm so pissed at him? How good looking am I? I'm looking for an objective answer.
Oh, okay, then it's an appropriate question.
What if the patient's problem is a physical reaction, not an emotional one?
Sjogren's would inhibit her normal secretions.
Chase is having a crisis right now thanks to the bet with House, as he's lost all faith in the female gender. I mean, don't get me wrong, of course looks help, but they would only get him through the door, not hold it open. Only personality and compatibility can do that. But we know the real Chase, the one that's smart enough to come up with a House-esque epiphany from reading about angry foragers between the sheets. That Chase holds the door open. But what if it isn't Sjogren's syndrome and it's actually something else that's making sure the Nile is in the Sahara? Yes, the Nile actually runs in the Sahara. My first idea of hemolytic uremic syndrome doesn't seem to work, as the patient's kidney function is still normal. Let's see, now we have brown urine, dryness and spontaneous bleeding. The liver is actually involved in hormone balance. If it can't regulate her levels of estrogen, then that could cause all her symptoms. It's part of the reason why men with liver disease sometimes develop breasts and get female patterns of pubic hair. It seems like everything's pointing to the liver, and I have my suspicions, but the question of what is still thoroughly on the table. Let's get more clues.
Sometimes it's easier to open up to people who aren't looking at you. I'm actually not comfortable on my back.
I've booked our patient in for heart surgery. I was doing a scialogram on her, and she didn't want to lie on her back.
Her mitral valve is nearly gone, which means she's nearly gone. God, you're pretty.
So we can replace the mitral valve with a pig valve or with a plastic one?
I'm afraid you two will need to agree on that decision earlier than planned.
Can you pass me my laptop?
Seriously.
I want to get some feedback.
What a huge life decision, and the first thing she does is defer to her blog readers. Look, I'm all for the social revolution, but this is about 16 steps too far. Having worked on cardiothoracic surgery, I was personally involved in these conversations, and many patients in her situation ended up with a pig valve, even though it doesn't last as long, although we do now call it a tissue valve. So why would a young woman want a valve that doesn't work for as long? Well, it can be implanted without the need for blood thinning medication. That means she can get pregnant without harming the fetus. Mechanical valves need warfarin to keep the blood thin and stop blood clots forming that can be potentially fatal. The even bigger issue here though is that the patient herself isn't sure if she wants kids, whereas her partner does want them. Well, why is that an issue? Well, if she opts for the mechanical valve, she will permanently be unable to fulfill her partner's wish. That makes it even crazier that she would think about getting the blog's input first before his. I know this isn't sterilization, but of the female patients who actually get sterilized, around 1 in 6 regret the decision afterwards. They're also more likely to if they get it done while pregnant, when young, or while in a relationship transition state. Why is that relevant? Well, she may think she doesn't want kids now, but there's a pretty decent possibility that she could regret that decision. Either way, it's our job to give the patient the fact and let them make a decision in either direction. Regardless of which one she chooses though, what could this be? We now know that she has sudden onset spontaneous bruising, brown urine, and a complete collapse of the mitral valve. In all fairness, it is pointing towards rheumatic fever, which can start from our immune system getting sensitized from a bacteria in the throat called group A strep. The bacteria has bits on it which are similar to our body's own cells, so when our immune system attacks it, it can get confused and cross-react with the heart valve and potentially the kidneys as well. So how could we fix it? Well, steroids and antibiotics definitely would help, but I don't think that diagnosis is really house level enough to include. The episode title is called Private Lives, and I can see why, because our patient is about as private as a streaker in the Super Bowl. Yes, there's nothing private about seeing privates. It could also potentially be autoimmune connective tissue disease, or this would work really well, adult polycystic kidney disease. Either way, we need more clues.
Please, Frankie, don't tell them.
I'm sorry.
Get my Vertigo poster back. I'm looking to get something on house.
Couldn't you just ask the love nymphs for the secret? He's reading The Golden Bowl. That book's at least 400 pages long. Whatever he's reading is only half that thick. He took the cover off The Golden Bowl and put it onto this other book so no one would know what he was reading. He's ashamed of it.
I'm going with plastic. I don't want another operation later.
You've turned our lives into their entertainment. Don't give them this. Or if you do, don't expect me to be here.
Got it. Step-by-step sermons for everyday life?
Why would he read this?
Why would he hide it?
What a hypocrite. How can we use this in a cruel yet funny way?
Are you gonna be here when I wake up? It hurts.
Your appendix burst.
It was full of abnormal cells, consistent with lymphoma.
I have cancer?
Oh, I know drama makes for good content, but this is one of those rare situations for which boring is best. In all fairness though, this episode in terms of medical accuracy is absolutely all over the place. Lymphoma doesn't really link in with the valve issue, which also doesn't really link in with bruising. But maybe there's something else here that we're not quite seeing. Would it be lymphoma as her main issue and be something else? If they've just gotten a sample from the appendix and haven't staged it, then it could be a small localized issue rather than an all systems go emergency. Of course, finding cancer anywhere is a big deal, but there are levels of big deals. They range anywhere from tell work I'll be off for a week to can I blog from the afterlife. Either way, it's interesting that she chose to go for a mechanical heart valve, which she called plastic. They aren't usually just plastic in all fairness, they're usually a mix of titanium polycarbonate and plastic, but that isn't quite as snappy as the valve is. See, that's funny because when you're in a room with someone with one, even without a stethoscope, you can hear the valve snapping shut. Something else snapping shut though is House finding his sermon book. What's going on there? Is it a double bluff to trick Wilson into having the upper hand when he actually doesn't? House basically found out Wilson was in a porno when younger, and in it he said the forest nymphs taught him how to please a woman. What a line. This is the thing about House. It covers the serious stuff, but also cuts through it with the comic relief. So good. Let's see if this is actually lymphoma, because that really throws a spanner in our mechanical works.
When your appendix burst, it was like a dam giving way.
That's why no valve. It's pointless.
Our Dean of Medicine has approved an experimental treatment to create a targeted lymphoma vaccine.
Without it, what kind of time are we talking about?
Based on people in situations like yours, maybe a year.
Whatever we have to do, we'll do. I can take care of you.
We'll start with the treatment whenever it's ready.
Is she being a good soldier or is she in denial? Hey, Sandy, can I borrow your car?
She gave me the keys.
I've been deluding myself that I'm actually connecting with people.
The first person I ever fell in love with turned out to be a total tool. Figuring out who people are takes time.
I could take from this that anyone who loans me their car has an ulterior motive, or that it's just a nice thing to do.
Why are you reading a book by a Unitarian minister?
Book club.
I know that you have trouble sometimes with the pain without the Vicodin. Is that it?
I'm all right, trust me. I appreciated the inscription about the benefits of prayer before medical treatment.
I called the author. He's got cartons of the thing in his basement.
Did you mention me?
No.
Fever's at 104. The antibodies tripped her autoimmune response.
She was all right when I woke her this afternoon to give her the second injection.
Who can sleep in a hospital during the daytime? Look at the timestamp on this post. 2:30 a.m. 6 months ago. She's posting in the daytime.
Oh, that looks like an epiphany moment if I've ever seen one. She switched from day posting to night owl, so how could that happen? Look, something suspicious has to be going on here. This patient wasn't surprised when she was given the lymphoma diagnosis, and she wants to post everything online as it's clearly the most important for her. If this lady has any more red flags, she'd be a red carpet. Oh, I have a theory. Earlier she said a bit of a misplaced statement saying that she can't hide things from her blog, otherwise that would be disingenuous. So what if by some misplaced dedication to honesty she feels she needs to spice things up by poisoning herself? It could be some kind of Munchausen syndrome, as the toxin she used made her shift to having energy during the day rather than her natural night owl self. So what could that be? Well, ecstasy or MDMA could do it, I suppose. Now she's in hospital, she can't self-poison anymore, so she's reverted to her natural owlish state. That doesn't quite explain the kidneys or lymphoma though. What if the poison was with something a bit more creative, like pesticides? They could dampen the parasympathetic rest and digest nervous system to keep someone awake during the day. They've also been linked to lymphoma, and now exposure has stopped, so has her daytime energy. Oh, that would be an absolutely wild diagnosis. Okay, self-poisoning with pesticides has to be my second diagnostic guess. Let's see if I'm right.
Day-night reversal.
Sign of liver disease?
We know she has the cell atypia that indicates lymphoma. Biopsy her liver. You want to make out?
You don't have lymphoma.
We now think they were granulomatous buildup from some unknown cause.
I'm not dying.
You're actually dying more quickly than we thought.
You have 3 or 4 days.
What the hell do you mean I have 3 or 4 days?
Maybe we didn't cause a fever. What if it's a new symptom?
Has to be an infection.
There has to be something she's not telling us. Start her on broad-spectrum antibiotics.
Your biological father is a minister? If you wanted to meet him now, get an idea of what he's like, why not just go talk to him?
I was mildly curious.
All your life, you've thought this was crap.
The actual epiphany moment! And I've still got one diagnostic guess left. My suspicions were right at the start that this bleeding could have been because of liver disease, but now we know it's likely an infection. They dismissed the fever thinking it was caused by the vaccine, but when they stopped it, then she continued spiking temperatures. Now we know the infection might just be from the rear cannon. It makes complete sense. Why? Because surely it's impossible to give every single life detail on a blog, including if your trip to the bathroom was rabbit pellets or fire hydrant. People probably aren't so interested in that either. Maybe she's had hidden ongoing diarrhea for a few years and has had a parasite causing it all. Oh, that would fit so well, and broad spectrum antibiotics the house just commissioned wouldn't work on them either. But what type of parasite? Well, there is one called liver fluke that can infect people when they have contaminated water. It migrates to the intestine and can cause fever, abdominal pain and diarrhea, and then accumulate liver damage over time. Eventually, it can lead to liver failure through its expansion, and only specific antiparasitics like triclobendazole would clear it. Some cases even need surgery. That could explain all her symptoms. It even makes sense with the story that ironically the only details she left out of her blog about her poop habits were the ones critical to the case. Alright, I'm going for liver fluke as my third and final diagnostic guess. We are locked in.
Do you poop? Sinkers or floaters?
This is the wizard.
Greasy and soft or hard and pellet-like?
Floaters and the first one.
You're a hypocrite. 4,000 pages, not one word about BMs.
Nobody wants to hear about that stuff.
Malabsorption. Her system's not retaining the necessary nutrients. Whipple's disease.
Start her on cotrimoxazole.
I'm gonna be okay.
And you'll be on meds for a few years, but basically, yeah.
I think I want to go with the pig valve.
I know you'll go crazy if you don't tell people.
Thank God you're an enabler.
People mate, they're like something superficial. They fill in the blanks with whatever they want to believe.
Is that what this is about? You and Cameron? You felt something real. So did she.
Can I borrow your car?
No.
Get maintenance to take that down.
Whipple's disease! Damn, it makes sense with the whole greasy thing rather than just diarrhea. Such a good case. I've mentioned Whipple's disease a few times in these reactions. Can't believe I missed it when it actually came up. It's caused by quite a slow growing bacteria called Tropharima whipplei, and all it takes is some antibiotics to put her career as an afterlife blogger on hold. Also interestingly, it turns out House was reading his biological father's sermons to figure out if he has a mind like House. Apparently it turns out that he doesn't, since House said under the God stuff there was just more God stuff. Seems like Chase has also come to terms with the fact that it wasn't just his superior looks destroying his relationships, and he also had a part to play in it. You know, that whole tiny murder thing. So crazy. This episode has got to be up there as well. 8.2 out of 10 entertainment, I'd say 7.1 out of 10 accuracy, and 8.4 out of 10 diagnosis. But this whole series makes more sense when you watch the previous episode where we see the hospital from Cuddy's perspective.